Why PCOS can affect your love life. There is ample evidence to suggest polycystic ovarian syndrome is linked with depression, which in turn leads to a low sex drive. Likewise, polycystic ovarian syndrome often results in obesity, which can cause fatigue, sleepiness, and stress, all factors in low libido. Women with PCOS have lowered fertility and have anovulatory irregular periods. Hirsutism, acne, alopecia, and infertility can lead to diminished feminine identity and psychological stress in women with these patients of PCOS. Women with PCOS are at increased risk for depression and anxiety disorders. Several studies have revealed diminished quality of life in PCOS patients. Women with PCOS and their partners are less satisfied with their sex life. Alterations in physical and aesthetic standards like hirsutism, obesity, acne, and alopecia, and an imbalance of sexual hormones are consequently observed, which can lead to a loss of quality of life and to the sexuality of the patient. A greater prevalence of mood disorders such as major depression and bipolar disorder can also coexist. Both of the mood disorders and their medicinal treatments are also harmful for the sexual function. The greater part of the studies specifically directed to the evaluation of the sexuality of patients with PCOS refers to psychosexuality or the sexual orientation. Studies that go profoundly into the sexual function of patients with PCOS are rare. Changes in physical appearance associated with polycystic ovarian syndrome may lead to decreased sexual satisfaction. Marital distress may arise following the diagnosis of infertility, and women who have had multiple unsuccessful treatment attempts are known to be at a greater risk of psychological distress. These studies suggest that psychological factors and partner relationships are important factors formative of sexual function. Thus, a two-group study to demonstrate the relationship between sexual dysfunction to social and psychological factors are necessary to determine this. Infertility or difficulty getting pregnant can dramatically affect the couple's relationship. Opening your private sexual life to medical professionals can really hamper your intimacy as well. Even being told when to have sex and when to abstain eliminates the spontaneity and fun that comes in being as a couple. It is not uncommon for couple to fight during this time, especially given the financial and emotional strain of fertility treatment. If you feel like your infertility is your fault, know that infertility is common and there is nothing to feel ashamed about. Infertility does not have to destroy your bond with your partner. There are many things that you can do to restore or maintain intimacy and spontaneity of your sexual function. Work with your partner to think of fun ways to initiate sex and make time to appreciate each other. It doesn't have to be inside of the bedroom. Making time for each other can help improve your relationship and make trying to have a baby more rewarding. Despite being directed by medical professionals, women with PCOS come from various backgrounds, culture, religion, socioeconomic status, and other comorbidities. Physicians and healthcare providers must ensure that they have to assess the emotional distress on an individual basis. Treating a polycystic ovarian syndrome patient should be multifaceted and include a team of medical experts. The extent to which physical symptoms have been correlated to psychological and emotional distress is limited and needs to be explored. Although the studies are scarce in this dimension, a majority of experts acknowledge the psychological burden of women with PCOS, and it cannot be ignored and should be treated as a secondary symptom. Treating the patient holistically seems to be a very simple answer to a large problem, and this will only happen if healthcare professionals are committed to increasing patient education, helping patients find the proper treatment for all aspects of the disease. So a functional medicine approach to this issue can be really beneficial because it takes into account your whole body as a whole, your genetics, your environment, and every aspect of health. physical, mental, and spiritual, and creates an individualized and customized plan to address this need. I hope this video was helpful.